The Council for Medical Schemes released its latest annual report. The report detailed medical scheme membership movements between the end of 2019 and the end of 2020. The report highlights various findings, including how Discovery Health Medical Scheme lost almost 50,000 beneficiaries in 2020 and how medical aid was cheaper during the COVID-19 pandemic. Let's speak now to Michael Willie, who is the General Manager of Research and Monitoring. A very good afternoon to you, sir. Thanks indeed for your time. So when I read this, as our team had sent us a brief, medical aid cheaper during this pandemic? How so? Okay.
Good afternoon, Chriselle, and thank you so much for inviting us, and also good afternoon to your viewers. So, as an effort, the Council for Medical Schemes is a regulator of medical schemes, like the funders in the sector. So, as an effort to try and assist members during that pandemic, so what we have done, we actually published guidelines for medical schemes to try and keep the premium as low as possible. In fact, the guideline actually outlined that medical schemes need to keep the premium as low as 0%. And then if they cannot do so, then we kept the premium increases at 3.9%. So most of the medical schemes actually complied with those guidelines. About 45% of the medical schemes in terms of the number, but in terms of beneficiaries, it's actually slightly higher than that. We're able to keep the premiums lower than between 0% and 3.9%. So that is what we are talking about there. It's more like some of the intervention that the CMS has put in place to try and assist members during 2020.
Quite notably, I mean, the impact and the effects of COVID-19 also seem to have negatively impacted the number of lives covered due to, for example, job losses. To what extent has this affected the number of people who would otherwise want to have access to that private health care?
Yeah, so basically, the sector actually covers about 16% of the population in 2000. So relatively speaking, if we were to compare that to 2020, so the number of lives that were covered was sitting just under 15%, right? So if we were to do a pound-to-pound comparison between 2019 and 2020, we had 8.9 lives that were covered by medical schemes in 2019, and then that number declined to 8.89 in 2020. So it's a loss of about 100,000 lives. I think in the main, the contributing factor here, it is the results of the lockdown measures that were put in place in 2020. And it's also consistent with the labor force statistics released by Statistics South Africa, because one will understand that belonging to a medical scheme is really a function of employment in the main. Yeah. So definitely the job losses as a result of COVID-19 had an effect on medical schemes as well.
Mr. Willie, I mean, what are the other contributing factors? Because I also understand, according to that report, the number of beneficiaries covered by medical schemes has remained stagnant already in the past decade, not surpassing the 9 million mark.
Yes. So I think it's a function of affordability. Medical schemes, by nature, they are very expensive. I mean, it's on average, a healthy individual who actually utilizes healthcare services contributes about 20,000 rand per annum. So it's quite expensive. It's a hefty fee that one has to contribute. So it's a function of affordability in the main. And then we also see in terms of the age profile of medical schemes has increased in terms of the demographics, in terms of the age, it has increased, indicating an aging profile of members. The second observation that we see is a slight increase in terms of pensioners. And the third observation is the increase in dependency ratio, meaning that we are actually seeing less principal members covered in 2020 compared to 2019. So it's a function of affordability in the main. I think that is the main contributing factor.
Thank you very much indeed for your time, Michael Willie, the General Manager of Research and Monitoring at the Council for Medical Schemes.